On August 6, 1945, the first atomic bomb was dropped over the city of Hiroshima. Although the impact of the blast claimed countless lives as it leveled the city, no one was prepared for what was to come after. Those who were able to survive the initial hit soon faced the radiation-infused aftermath. The amount of horrific casualties from the attack rose as the survivors began to severely vomit, convulse, or lose consciousness. Those who encountered the highest dose of radiation passed 2 to 3 days after the strike, while those who were not so lucky suffered through nausea, diarrhea, and thinning of red blood cells, only to meet their death in the following weeks. This event continues to be one of the grimmest in history. So what's the difference between the radiation that took all those lives and the radiation used in medical imaging? As it turns out, not so much. It shook me to my very core when I first realized something that is used so loosely in healthcare can be the very thing that can cause you problems later in life. That's why I want to ensure you know the dangers involved in medical imaging that uses radiation and how to best protect yourself. This information is significant because everyone will probably receive at least one form of ionizing radiation imaging in their lifetime, whether that be an X-ray at the dentist, a simple step before a procedure, or a CT scan through the emergency room. Everyone should know how to properly protect themselves in these situations. I have come to learn about the dangers of radiation and the harmful effects on your body and the steps to prevent it through my major here at Arkansas State, Medical Imaging and Radiologic Sciences, and I am also employed in the radiology department at NEA Baptist. So before we dive into some of the actions that we can take to protect ourselves, I would like to discuss why we need to do so. What is worrisome about medical radiation is the ionizing activity that occurs. According to Professor Stavin, the author of Radiation Protection and Dosimetry, an introduction to health physics, when atoms in living cells become ionized, one of three things can actually happen. The cell dies, the cell repairs itself, or the cell mutates incorrectly and can become cancerous. Not all cells are affected by ionizing radiation in the same way. Some cells can actually be spared from the radiation in an exposure due to the random activity of how radiation interacts with our bodies. However, that's why it's so crucial to be cautious because no one knows how it will affect them specifically. The cells that reproduce rapidly and are the least specialized are the cells most likely to be harmed by ionizing radiation, such as the cells in a developing fetus. In Fetal Implications of Diagnostic Radiation Exposure During Pregnancy, author Ramawi shares that prenatal radiation exposure, which occurs when the mother's abdomen is exposed to radiation from outside her body, can result in health defects. The possibility of severe health effects depend on the gestational age of the fetus and at the time of exposure and the amount of radiation it is exposed to. According to Dr. Ramak in The Safety of Radiographic Imaging in Pregnancy, the most critical time for a fetus to be exposed to radiation is during the first trimester due to the embryonic developments of their major organs. Since their cells are constantly multiplying at this phase, they are easily harmed since the embryo is not fully developed. For these reasons, it is vital to protect yourself during an exam. Due to the known detrimental effects of radiation to human bodies, certain precautions should be practiced when an exposure is to take place. Each examination should be justified and the benefits and risks of the intended procedure should be considered. The possibility of using other methods that do not involve radiation exposure, such as an abdomen ultrasound over a CT scan of the abdomen, should always be explored. Once justified, the examination should be performed with minimal radiation dose. This requires achieving adequate image quality while keeping the exposure as low as reasonably achievable. This is the principle of ALARA that is stated in a list of ethics by Merrill's Atlas of Radiographic Positioning and Procedures the radiology staff is expected to follow. In addition to minimal exposure, the tech should provide a lead shield to cover your radiation-sensitive organs such as the gonads, breasts, and thyroid if it does not interfere with the exam. Another key aspect that needs to be remembered is to inform the tech if you are, or if there is even the slightest possibility that you could be pregnant so you can properly be shielded during the exam if possible. In the textbook by Elsevier, Patient Safety in Medical Imaging, it informs us if the X-ray or CT does not include the abdomen, lower spine, or pelvic area, then we can place a lead apron over the abdomen to ensure the exposure is as limited to the fetus as possible. As a patient, you always have the right to refuse the exam if you feel it is not needed, or once again, do not feel the benefits outweigh the risks, which is not a justifiable examination. With these tips in mind, I hope you remember the significance of the points I brought to light today the next time you are in need of a medical imaging, such as an X-ray or a CT. Although radiation is a known carcinogen and can be harmful to our bodies, there are ways to prevent these detrimental effects by shielding and following the ALARA principle.